even if CMS creates codes for different products, without a benefit category, no patients in Medicare and possibly Medicaid will get access to these products. So there's an inevitable health inequity there, where if you're commercially covered, you may get access. If you're covered by a government, Medicare, Medicaid, you don't generally have access. So we need this benefit category to enable the recognition that these products exist, to enable Medicare to actually evaluate and then provide access to these products.
Welcome to the Digital Therapeutics edition of Digital Health Today. And I'm your host, Eugene. I thoroughly enjoy bringing you discussions with incredible industry leaders in every episode. And it would mean a lot to me if you could rate the podcast in your favorite player and hit that bell to be notified of future episodes. Do it now. In the previous episode, I spoke with Jenna Carl, Chief Medical Officer at Big Health. In their own words, Big Health believes in mental health care for all and that their digital therapeutics are safe and effective non-drug options for mental health. Given the overall market dynamics, investments climate, and recent bankruptcy news, I personally get asked all the time about the future of DTx. My short version, it's here to stay. But I also decided to bring back Megan Coder, Chief Policy Officer of the Digital Therapeutics Alliance, to talk about all the exciting and positive things that are happening in the industry. The DTA just concluded its first ever summit in Washington, D.C. They released a new definition of DTx, a new evaluation toolkit, and in partnerships with Healthware, a new DTx European Policy Report. So many exciting things to talk about. So in this lightning fast episode, you get to hear all this and all in under 15 minutes. But before we dive in, the only thing that's constant is change. Yes, that is one of my favorite quotes. And given the constant change, we're also experimenting with new formats, such as this episode. And I would love to hear from you. Please feel free to reach out to me directly on LinkedIn with your thoughts, comments, and ideas, or just drop me a quick note at eugene@yourcoach.health. I hope you enjoy my conversation with Megan. Megan, welcome back to the DTX Podcast. I feel like it was yesterday, but I know you were in season 1, so that was already years ago that you've been on this podcast, which is crazy.
It's been a bit. Glad to be back.
And for those who are just tuning in, give us a little bit about Megan Coder and yourself, but also don't forget about one interesting fact, because I was not asking that question in season 1.
All right. By background, I am a pharmacist by training, but I've really been in the health policy space for the last bit of time. I founded DTA in 2017 and have really been dedicated to this entire ecosystem and really making sure that patients have a really strong foundation to receive high quality care through digital means. So all of that to say, one fun fact is I now live in Jersey, but there's an original Jersey, not the new one. So what I didn't even know 4 months before I moved here was that there's a 9-mile by 5-mile island off the coast of France and Guernsey that's part of Great Britain. And that is where I live. And back in the day, they sent someone to the New Jersey to found that one. And we have a statue of that individual here in one of our main squares. And that's where I hang out.
That's a super interesting fact. And I was going to say, is it Jersey? But it's a different Jersey.
Totally different Jersey. We have a lot of cows. It's gorgeous, but super tiny.
Well, let's dive in. So again, super interesting fact, and thanks for sharing. But let's dive in. As you mentioned, you founded the DTA in 2017. It went through its own iterations, but also a key component of that has been defining what digital therapeutics are. And I know there's been some recent updates to that, specifically with ISO. So tell us a little bit of why the changes, why ISO, and what is that new definition, and how does that impact the companies, but also us as patients, consumers?
Yeah, so this was a thing that developed actually out of requests that I initially put into the FDA, asking if they would be able to define what a digital therapeutic is. And part of that came out of this idea that everyone's like, how many digital therapeutics exist? And I was like, well, once we have a regulatory classification, then we can actually know how many exist and we can go from there. That said, they said that's great in theory, but in principle, we would need to adopt something that has an internationally recognizable perspective. So I took that challenge and we ended up working with ISO, the International Organization for Standardization, to start this process. So we had 40 some countries come together over the course of 2 years to really look at how would one define a digital therapeutic. And since it's a medical device, how would we go about framing it in a way that fits in with the other medical device standards that exist and build from there? So last week, the formal definition of a digital therapeutic finally launched, and it was really great to see because it went through 2 international votes. It was developed by international standards organizations. So what we as DTA are going to do is actually adopt that definition. And then I developed a 5-page document on DTA's site now to walk through a little bit of why we've adopted it, how it differs a little bit from the initial one, but then also what the implications are going forward and how we interpret that definition to really describe the industry as a whole.
It's interesting, maybe just a quick follow-up on that question, because you mentioned, obviously, as you have a regulatory definition of it. So does that mean kind of the wellness or non-prescription digital therapeutics are out of that definition?
Oh, this is where it gets fun. So we put together this toolkit for policymakers and payers and really any form of decision maker to help them understand what are we talking about. So one of the things in there does refer to this definition. Another one talks about market access pathways. Another one talks about prescription versus non-prescription opportunities for digital therapeutics. So one of the things I wanted to myth bust a little bit is that non-prescription means OTC, and that's not the case always. That may be the case, but it isn't always the case. So in this regard, we are distinguishing digital therapeutics from health and wellness. In the definition of a medical device, the words treat and alleviate are in that definition. So we saved those 2 words, but anything that is in a primary prevention or other kind of a wellness space is not in the DTx space. What ISO standards individuals were talking about is this has to be for secondary and tertiary prevention because a disease state or condition of some sort needs to be present for you to be able to then treat or alleviate or manage in some form or fashion.
And let's dive deeper into the evaluation toolkit. That's another thing that the DTA worked hard on and releasing, and you kind of started alluding to it. Maybe let's back up. Why did you guys even put this together? For who? Who is the intended audience? And then maybe kind of take us through, I'm sure it's pretty comprehensive, but take us through kind of what's in it. What should we expect?
Yeah, I always get in trouble for putting out too long of documents, and now I put out shorter documents, but like 20 of them.
But now we can ask ChatGPT to summarize these things, right? So for us, which is okay.
That is a crazy ecosystem to be in now. But yes. So how this came about, we are honestly just really proud of all the decision makers who have gone forward and started making up their own requirements to bring digital therapeutics into patient access ecosystems. So whether that's payers at the local, government, or national levels, that's been incredibly encouraging. That said, without having a standardized or harmonized approach for them to lean on, they've been making up their own pathways, which has led to, let's just say, a scattered framework of options that digital therapeutic manufacturers need to really meet. And that's hard for them. It's hard to have to meet different requirements for every single hospital, clinic, or regional ecosystem that you're trying to work with. So what we wanted to do is bring policymakers together, and we did that in the form of a coalition of European, US, and Australian policymakers as this first pass to find out what's going on in your spaces, how are you approaching this, what do you need to be able to move forward. So we took all those inputs into consideration in addition to many others over the past couple of years that we've generated and started to say, okay, if we are going to make a resource available to you, what are the steps you may need to consider? So first, you need to know what digital health technologies are. Then you need to know what a digital therapeutic is, and they need to know how to assess it. But then how do you assess it for clinical impact or for economic impact or so forth? So we put all those steps together, and then we married that and tied that to a list of publications and resources of, if you need to know this, here's how we can help provide some insight into that. So it's a one-to-one relationship in terms of steps and resources, but we really hope it's a way to help people understand, there is something out there that we can adopt. We can start to create more of a fit for purpose pathway for digital health technologies and DTx in particular, and really start to create some harmonizations, hopefully, in how the requirements are being developed, again, locally, nationally, regionally, and so forth.
We're going to take a quick break and be right back with Megan Coder, Chief Policy Officer for the Digital Therapeutics Alliance. I also saw, and this is why I love this, quick short episode with you, just to give our listeners a bit of an overview. Has this been some let's call it negative news. We need to focus on all the great things that are happening in the space in the industry, right? So I know DTA partnered up with Healthware, and we had the pleasure of having Alberta on the show as well a few weeks back on the DTx Policy Report. And so maybe tell us a little bit more about that. I know it's pretty comprehensive. I've downloaded. I haven't read fully, but I think it's like 58 pages of great stuff in there. But tell us more.
This actually built off the coalition that we launched. So we brought this coalition together and we did quite a few series of interviews with different individual governments, with trade associations, with policymakers, ministries of health, trying to get their perspective on how they see, and I'm going to use a term here, HTA, processes unfolding. And HTA is health technology assessment. It's basically the pathway after regulatory. So once you get your CE mark in Europe, or the US would be the version of FDA clearance, then you generally proceed to an HTA pathway. And that's when evaluators will come in and say, okay, we see your technology, but we're going to need some additional data, some insights to verify that it's right for our population, that's scalable, that's going to have the right impact, and so forth. So what we did is we started mapping out what exists. So we looked at, obviously, the Germany, France, UK pathways that have existed or have been recently announced. But then we also dove into what's going to be evolving in ecosystems like Estonia, the Nordics, and other places. So we can start to say, here's what exists as a formalized pathway, here's what's emerging. And then cheers to their team to help with this. But we started looking at where are things already converging? What's already becoming harmonized? In addition to what is going in different diverging areas where harmonization is actually becoming further from scope within that regard. So that deck is pretty hefty. It's fairly impressive, and it will need to be updated. After we launched this week, I imagine that there'll be a lot of changes to different pathways. So it'll need to be a living document, but it really is a first step for us to help companies and policymakers understand what exists, and then how do we build from there.
You mentioned the word diverging earlier. I'm curious if you can give our listeners an example of, one or two things that are diverging.
One example is this idea around how are products categorized. So if it's therapeutic versus monitoring, if it's telesurveillance versus some other terminology, we're seeing a lot of different terminologies emerge. We've also seen risk classes differ, how countries are starting to say this is a higher level of risk, it needs more requirements, more oversight, more whatever the case is, versus other countries. And then also, obviously, pricing and access to patients. One of the things, just to nerd out a little bit more, that I've proposed is I'm really trying to get this idea solidified and work with other individuals to figure this out. But I really want to propose this idea of a multifunctional digital health technology. So we know that digital health technologies have a lot of different components, whether it is a diagnostic component or a monitoring component, therapeutic component, care support component, and the list will go on. What I would love for us to do is start to create some understanding of what those individual components are, categorize them, and then know what are the requirements for a therapeutic component and how do you define that? What are the requirements for a monitoring component? How do you define that? So that way then, when these countries have different pathways, whether it's DIGA, PECAN, DHT, or otherwise, they can keep that and they should, but retaining the national nomenclatures is great. But at that level, that should cut across the bottom line of all the different components, therapeutic, monitoring, diagnostic, care support. We should know what that is. So patients know what that is. So clinicians know what that is. So manufacturers know what that is. And then when products are starting to be more multifunctional in nature, we know how to better approach those and have the requirements in place to actually enable access. So that's my nerdiness minute, but something I would love to see evolve over time.
I mean, it also sounds like an evolution from what you guys put together. And I think it's wonderful to see, right? There's always the top-down approaches and the bottom-up approaches. And what I love about this evaluation, just toolkit, but also the policy report, is that you do see a lot of harmonization already. And there's certainly, pricing is a good example of divergence, which is understandable. But I think if you have some common definitions across, it makes it easier for all to understand. And it's not a top down or bottoms up. It sort of just continues evolving that way. So let's get to the final topic. I know which I had a major FOMO not being at the DTA Summit, the first inaugural summit. I missed all the selfies, but of course also a lot of the content and the discussions. So for our listeners, maybe a little bit of what was the purpose and the fact that you guys were on the Capitol Hill. So tell us a little bit about the act that's being put forward, a little bit of the details. So the what and what are the next steps there that we see?
Yeah, so we have been around, as I mentioned, for almost 6 years, but this was our first ever public-facing event of this regard. And what we wanted to do was have it be an actionable summit. So we wanted action on the front end, summit in the middle, action on the back end, and really wrap that up in a holistic way. So on the front end, we had 2 days on Capitol Hill where we brought together 30 or 40 of our members and did a series of meetings on the Hill with different representatives. What we were trying to aim for is this idea that even if CMS creates codes for different products without a benefit category, no patients in Medicare and possibly Medicaid will get access to these products. So there's an inevitable health inequity there where if you're commercially covered, you may get access. If you're covered by a government, Medicare, Medicaid, you don't generally have access. So we need this benefit category to enable the recognition that these products exist, to enable Medicare to actually evaluate and then provide access to these products. So that was that side. The summit itself had some really great panels and really good engagement. The back end of it then had 2 workshops, one that was focused on workflow and integration, one that was focused on patient and clinician education. So it was this idea that let's just build into the everyday work that we as DTA are doing. Let's bring all of the attendees together, hash out different ideas of how we can improve upon, what next steps should be, and then move forward with some actionable next steps. And then the final panel, which was my favorite because I'm biased, it was government representatives. So when we talk about regulatory, we often only think about FDA in the United States, but we're missing out on sometimes CMS, on AHRQ, on SAMHSA, on NIH, on ONC. So all of these different organizations are already working together. They already are collaborating behind the scenes, and it's not always visible. So we brought them all together to talk about how do you work together? What do you need from us? How do we move forward? How can we best support you in your efforts to really enable this ecosystem to deliver care to patients in a way they've never been able to receive before?
So in this very short amount of time, I think we summarized months and months and months, if not years of work of many individuals.
I would say years.
Years, exactly. Well, like you said, it's been 6 years. So really appreciate you on such short notice jumping on and looking forward to having you back with some more positive news over time.
Thanks so much, Eugene. I really appreciate it.
Thanks for tuning into the Digital Therapeutics edition of Digital Health Today, a production of Mission-Based Media. Be sure to subscribe to this podcast on your favorite podcast player so you're automatically notified each time I speak with one of these amazing leaders and trailblazers who are forging the path for digital therapeutics. If you'd like to learn more about Your Coach Health or Health Excel, you can find the links to this and more in the show notes for this episode. I'm Eugene Borohovich, and catch you next time.